So Dr. Kahn, you have had an impressive career so far, but would you like to introduce yourself first and like give us an overview of like where you're from, your specialty in the medical field, please?
Sure. First of all, thanks for hosting us. We're happy to be here. So I'm Ben Kahn. So my background is Thai. My parents are from Thailand, but I was born and raised in the United States. I was born and raised in Texas, and that's where I did all of my schooling. So I went to university in a city called Houston, and then went to medical school in Dallas, Texas, which is where I continued and did a residency in internal medicine at an institution called Baylor University Medical Center. And then I did a fellowship in gastroenterology and hepatology at UT Southwestern. I graduated from fellowship in 2016, and then I went and joined a practice at Baylor University Medical Center after I graduated from fellowship, and that's where I've been ever since. So I do, my practice is based out of that hospital. Baylor University Medical Center is it's a big tertiary care hospital based in Dallas, Texas. It's over 1,000 beds, and it's a pretty busy place.
Okay, that's great. You've had an impressive career so far. Can you start by sharing with us what initially inspired you to pursue a career in medicine, and more specifically in gastroenterology?
Yeah, so I think when I was in college, I majored in bioengineering. At that time, I had a interest in doing something like math and science related. I think medicine was always in the back of my head because of my father being a doctor. But I had some strengths in math and science, and so I was leaning towards engineering at that time. I think what kind of leaned me away from it was just I did an internship one summer when I was in college at an engineering firm, and it just wasn't as interesting to me as what I thought it was going to be. And that's kind of what led me into medicine. In terms of field inside medicine, it's kind of hard when you're in medical school to know what you like and what field you want to go into, right? There's a lot of guessing on your part. In the United States, you don't really get much of an exposure to the different specialties until your third year of medical school. So you're pretty far into your medical education before you can even get any type of exposure to the fields. And so going into medical school, I just kind of assumed that I would like to be a surgeon because my dad is a surgeon. And so that was kind of what I had in my head going into medical school. But my first rotation in my third year of medical school is internal medicine, and that's what I ended up liking the most. I think there's a lot of similarities between like what I was doing in college, majoring in engineering, and in internal medicine, because internal medicine deals a lot with physiology and how the body works, and when things happen, you get an infection or an organ's not working, there's things that there's downstream effects because of that, and I kind of liked thinking about all that stuff. But at the same time, I also wanted to work with my hands. I felt like a procedure-based field was what suited me the best. And so that's how I narrowed down into gastroenterology. I liked internal medicine. I still wanted to do procedures. And so I was looking at procedure-based fellowships of internal medicine. And so I was deciding very hard between cardiology and gastroenterology. And I just ended up deciding on gastroenterology. And that's kind of how I ended up in the field that I'm in now.
That is very inspiring. Could you tell us some factors that have contributed to your success in the medical profession?
Having a supportive family obviously is number one, right? You can't get anywhere unless you have support, and that means financial support, educational support. A lot of people don't have the opportunities that I did, so for those of us who are privileged enough to have those opportunities, you really got to take advantage of it, right? If you go to a good institution, a good school, then make sure you take advantage of that and everything that it offers you, right? It's going to offer you not just the schooling, right? But it's also going to offer you access to other successful people. And so I think that's just as important when you're going to a great school, high school, college, medical school, whatever it is. You really want to take advantage of the people who work there as well. So I think that played a role. I've had really good mentors along the way, from college to medical school, to even after medical school. The partners that I work with now, my older partners, you know, you just have to be really, really open to their experience, and you know, you have to try your best to kind of take in what they have to offer. I think that's really important.
See, shifting gears a bit, what are some of the biggest challenges you faced in your practice, and how have you addressed them?
I think the biggest challenge, so I joined, you know, there's different types of physician opportunities. Once you graduate from education, you know, as a gastroenterologist or other types of doctors, there's like kind of general fields you can go into, right? You could stay in academics, meaning you could stay at a big university or a big medical school, do some research. You could join a hospital-based system, or you could, what we call an employed physician, where you're employed by a hospital, you take a salary, and the last option is what we would call private practice, where you go and kind of just start your own practice, or you join an existing practice. And all of them have their pros and cons. I joined a private practice, and I think the most difficult part of that was actually building a practice. You know, I think I had this preconception in my head that after you graduate from fellowship and you get this job, then all of a sudden people are going to start coming to see you, and you're going to be really busy. But that's not how the way, you know, that's not, at least in the United States, that's not how it works in private practice, right? So when I started this practice, now you're trying to utilize skills that you never developed in medical school, right? In medical school, you just have to learn how to study and read and learn biology and anatomy and all that stuff. But now you have to be almost like a traveling salesman, right? It's a lot of meeting doctors, meeting internal medicine doctors, meeting surgeons, people who are going to refer you patients, right? Having a good rapport with your patients as well, so that they want to come back and see you, so that their relatives are going to come and see you. And so that was the hardest part at the beginning, was, you know, learning that, you know, you have to be available for your referring doctors, right? You have to really get out there, meet people, show them that you're a good doctor, but you're also a nice doctor and an available doctor, and someone that they're going to trust their patients with, right? So a lot of primary care doctors have a very special bond with their patients, and they don't want to just send their patients to anybody. And so it took years to kind of just develop a referral base, like develop relationships with these primary care doctors to kind of convince them to send the patients to me. So I think that was the hard part. You know, your medical school, residency, fellowship, that all trains you on how to be a doctor. I don't, you know, it's a little bit scary being by yourself, but that's what you've been training for your whole life. I think the hard part is like, wow, today I don't know patients came to see me. How do I get patients to actually come in through the door and come see me? So I think that was the biggest challenge for me personally when I started my practice.
Thank you. Looking to the future, what are some advancements in medical technology that you believe will significantly impact the field of medical doctor?
Well, it's probably AI, right? That's probably the thing that's going to affect every field, including, you know, not just in medicine, but outside of medicine as well. You know, in the field of medicine, there's already a lot of AI involvement in, like, the field of radiology, for example. There's a lot of AI involvement in the field of gastroenterology as well. So one of the technologies that's becoming prevalent is, you know, I do endoscopies and colonoscopies for a living. So the main point of doing a colonoscopy is checking for colon cancer, and then checking for polyps. Polyps are these small growths you can get inside your colon that are precancerous. They're not cancer, but they're what turn into cancer in the future. And so being a good gastroenterologist means being able to detect these polyps, right? Because if you miss a polyp, that polyp could potentially keep growing and turn into cancer, and that's how GI doctors miss cancers. And so there's a lot of AI technologies nowadays where you install this technology and it's trying to identify polyps at the same time as you are. So that's probably, me personally, that's the biggest kind of technological innovation that's going to affect me directly is AI and polyp detection. But it's going to affect every single field of medicine and everything else eventually.
Okay, so applying this idea to Thailand, we also face some sort shortage of medical professionals. In your opinion, do you think technologies like AI or maybe telemedicine, for example, could help address these challenges? And if yes, then how so?
Yeah, I think those technologies will definitely affect how shortages, the physician shortage. There's probably a physician shortage all throughout the world. In the United States, there's definitely a big physician shortage, but it's more concentrated in the rural areas of the United States. And it's hard to kind of attract doctors to go out into more rural areas. And so telemedicine has been a big game changer for that. I've had people that I trained with who started telemedicine companies where they were ICU doctors. And so in hospitals in more rural areas, you can't get an ICU doctor out there. And so they're doing, telemedicine through, being an ICU doctor through telemedicine. Same thing for, there's other specialties where you don't necessarily need to be there in order to take care of the patient. Radiology is probably the best example, but there's other examples like infectious disease doctors I know, do a lot of telemedicine type of stuff. So it's probably been a positive in terms of patient care, right? You are giving access to patients in areas where they would not have gotten access otherwise. I suspect artificial intelligence will also do the same, where if you're a doctor out in a rural area and you don't have a lot of support or, surgeons or specialized surgeons, that you're going to try to utilize AI to figure out, which patients you might need to transfer to a larger hospital, or which ones are ones that I could probably take care of by myself. So I think it does, it probably does improve access, and it's probably good for patient care in the long run.
In general, how do you see the future of medicine?
That's a wide open question. It's hard to predict the future of medicine. I got good advice when I was trying to figure out what kind of specialty I wanted to go into, and I still see it because I still, like, when I go online, sometimes I check, the medical student forums, and it's the same questions that come up over and over, like, what specialty should I go into? What specialty should I do that protects me the most against AI, or like people are concerned about their job prospects or whether they still have a job, or which specialty is gonna have the best reimbursements in the future, but nobody can know that, right? It's impossible to know, and every generation, every cycle, there's always something that comes up that might threaten the field of medicine, and it's impossible to know which ones will pan out or not. So, it's cliche, but the best advice that anyone can give you is if you're going to go into medicine, just pick the field that you think you're going to like the most, because you can't predict all the other stuff. My generation, there was, a lot of people thought certain things were going to go by the wayside. Like cardiologists aren't going to do as well because, these new technologies are coming out, and so you don't want to do cardiology, and or in the field of GI, reimbursements are going to get cut. You don't want to do GI, but it's impossible to predict those things. And a lot of these things never come to fruition. And so any medical student or college student that I talk to that's going into medicine, I really try to urge them away from that kind of train of thought where they're trying to predict, what's going to be in need in 10 years or when I'm out in practice. Just do what you like, because you're going to be doing it every day. You want to make sure that you really like it. Otherwise, you're going to burn out. Like, try not to predict the other stuff. Like, your future is secure no matter what field you go into. And so there's all sorts of stuff that might affect medicine in the future. In the United States, We talked about artificial intelligence. Private equity is moving into the field of medicine, and that's having a huge impact. You never know what the government will do in terms of, how they dictate reimbursements and that stuff, But all that stuff is like out of your control. I just do what you like and pick a field based on what you think you're really going to enjoy, like on a day-to-day basis.
That's very insightful. And lastly, what are some advice that you would give to aspiring medical professionals who are looking to build a successful and fulfilling career in healthcare?
Yeah, so you guys are mostly in high school, college, high school? Okay. I know the system here is a little bit different than what it is in the United States. Just take it one step at a time. Like in high school, you're focused on, I guess here, you're focused on getting to medical school. So, do the best that you can in your studies. That's most important. I think meeting people, either if you're interested in a particular medical school or a particular field, it's never too early to start meeting these people and talking to them. I started doing research in GI as a medical student, even before I was really interested in GI, and it ended up being very lucky because this guy, my mentor, ended up helping me a lot, at different points in my path, like in terms of applying to residency, applying to fellowship. So I can't stress that enough. It's like, seek out mentors that can help you in fields that you think you might be interested in. But I think take it one step at a time. Work on your studies, work on your standardized tests, try to do the best you can at them. And then once you get to medical school, then that's when you can focus on like, well, what do I like? Do I like doing procedures? Do I not like doing procedures? Do I like seeing patients or do I not like seeing patients? Like you can break down the specialties in that way where, what fits you as a personality? Like, do you like talking to people? If you do, maybe you could be a pediatrician or an internist. If you don't like talking to people, there's specialties for you there too. Radiologists, anesthesia. So I think, learn about yourself along the way. Try to figure out what you like to do, what you don't like to do, because you want to be doing this for a long time. And so the best way to do that is to make sure that you're doing a specialty that you love. What else? What else do I need to? Anything? Did I miss anything? Okay.
Thank you so much for sharing your experiences and insights with us today. It has been incredibly informative and inspiring. Please clap your hands for Dr.Ben and Kahn.
So, I guess one last thing is that, it sounds like all of you are interested in medicine. There may be some of you who are interested in going to the United States at some point. There's a lot of resources available for you guys if you guys choose to do that. There's a lot of Thai doctors who still are very involved with Thai medical students and have the ability or connections to help Thai doctors get to the United States to do their training there. So if that's something that you think you're interested in, reach out to me, email me. I'll leave my email with you guys. Email me, or when the time comes, call me, text me, and we can figure out, a way to help your chances and do, whatever we need to do for you guys to fulfill your dreams.
Thank you so much. We'll now be moving on to the next session where we have another two incredible guest speakers. Please join us in welcoming Dr. Andy and Dr. Amy Kahn, who will be sharing their journey to achieving their work-life balance and happiness in their medical careers.